Hello, this is Malcolm Bossa, here to do a diagnostic evaluation of the week 2 discussion board speech that we watched about sleep. For competency 1, assignment specifics, she had note cards ready, she had a slideshow ready, and she got right into her speech. She told us what it was going to be about in a very quick, brief statement manner. So for this part, I'm giving her a 5. For competency 2, her introduction, she did very well, I think. She told us that she was having a little bit of vocal problems and apologized if her voice was going to be bad. She told us what she was presenting, which is about sleep, why it's good for you, and what it is that causes bad sleep. She told us what she was going to talk about very, very nicely, and she used her hands to liven up the speech. So for this part, competency 2, the introduction, I'm giving her a 5 as well. For competency 3, supporting material or body of presentation, her visual aid was very good. She had the slideshow ready and used it very well. I'm not sure if she was the one flipping the slides. Looked like maybe she had a remote, so she did very well. She timed it well. The presentation aid was not her whole speech. It didn't just have blocks of text. It had pictures and bullet points to show what she was talking about, but she elaborated on what the bullet points were. The relevance was very helpful. She also had a CPAP mask when she talked about sleep apnea and how that aids to help them to breathe if they have sleep apnea. So for the supporting visual aid, I'm also giving her 5. She used it very well. She timed her slide switches very well. Competency 4, observable organizational pattern. She had note cards which showed preparation, but she also had the visual aid as we previously talked about, and she had the CPAP mask ready. Her transitions, as I said before, were quite good, but she occasionally added some filler like or just a momentary pause. So for this part, I'm giving her a 4. Competency 5, appropriate language. She gave us the presentation in a clear voice and did not use any slang or cause any unnecessary attention to herself by having an indiscernible accent. So I'm giving her a 5 for this portion. And going on to competency 6, vocal presentation. She did very well for this part with her previously stated vocal problems. She was a little sick. Her rate of speech was very good as well. She kept it going. She didn't have any super long pauses of more than a second or two. And her pitch throughout the presentation was very good as well. So I'm giving her a 5 in this portion as well. For competency 7, her pronunciation and grammar in this speech was very good. She explained some slightly complex terms like sleep apnea and explained other conditions that may cause sleep problems. And her articularity was very good. She didn't have any flowing, running sentences and then a big, deep breath. And her delivery was not like a staccato, just momentary bits or quick bullet points that she talked about. And she only had a few vocal fillers like or pauses. So I'm giving her a 3 in this section because of her pauses and her use of the note cards. And then nonverbal support, competency 8, was very was good, but could have been better. She looked at her note cards for most of the speech, and when she was not looking at her note cards, she was occasionally looking at her presentation on the screen beside her. And her note cards seemed to be very good and help her with her speech, but she looked at them too often. So I am giving her a 3 in this section. Thank you.